We are in Cape Town at the moment, where we just finished listening to a presentation by Dr. Mads Gilbert. He's a Gaza volunteer physician and an activist. He's biding his time to make his way back to Gaza, but in the meantime, he's on a tour of South Africa talking across the country about the real situation on the ground. Let's get straight into it and talk to Dr. Mads Gilbert. Thank you for your time, Doctor. Why are you visiting South Africa?
Because I think this is a lighthouse of understanding and resolute resistance against racism, colonialism, and brutality. I mean, what you have achieved here is so important for humankind. And I was inspired by South Africa when I was a child, and my mother boycotted all types of fruit from the apartheid regime. I think this is important to learn from your experience, and also to take part in the take part in the advocacy and the sharing of true facts. I'm a scientist, I'm a professor, so of course I like slogans, but I also like facts, and I have a lot of facts that mainstream media is not covering. And we need to get that facts also, because people need to have sort of an evidence-based solidarity. And I was invited by a media company to organize the logistics of the tour. And I was here in 2014 also, after the assault on Gaza then. And there are huge crowds, lots of good questions, and lots of solidarity energy. And I want to fuel that energy.
Let's get into you say there's not a lot of facts that's being shared by the mainstream media. Talk to us about some of those facts. What is the reality on the ground in Gaza that you get from your colleagues?
I guess if you ask someone in the world today, can you tell me about the hospitals in Gaza, they would say Shifa. And they would immediately come up with the question, was there a military base or not? In a way, trying to discuss, was it legal for the Israeli occupation forces to bomb or to occupy it or not? Listen, there are 36 hospitals in Gaza. When this started, 34 of them were actually functioning at some level. Now there are 8 remaining functioning hospitals in Gaza out of the 36. So it's not been about Shifa, it's been about an all-out attack on healthcare in Gaza by the occupying forces. The civilian healthcare in Gaza, of course, is protected under international law, so are the ambulances and the healthcare workers. All of these elements in the civilian healthcare has been and is attacked by the Israeli military. They bomb hospitals, they shell ambulances, they kill healthcare workers, and it's a part of their strategy to dismantle the Palestinian civilian society and the networks that we all need, in particular in disasters. And this is a man-made disaster, and of course, how can they do it? So I think that we need to get to know these facts, and the facts I use are from this latest report from the UN. It's not something I invented. And it's a careful counting. All the attacks on healthcare have been counted day by day. In Gaza, there has been more than 150 attacks on healthcare during these weeks, and more than 200 healthcare workers have been killed. So more than 100 healthcare workers have been killed. So these are numbers and facts that needs to get out. And mainstream media are sort of captured by the fog of war, by the propaganda, by the lies. And all these lies that have been spread about healthcare in Gaza, I've been working there for 20 years. I've never seen anything like that. I've never seen any soldiers or arms in the hospitals, neither in Shifa nor in any of the others. I've never seen any explosives or arms in the ambulances. These are decent people, doctors and nurses and paramedics and medical students like the one you have here, like the one I teach in Norway. And I'm extremely provoked by this insinuation that there is another standard, there's another understanding among Palestinians. It's pure racism. It's the old colonial racism. The Palestinians do not have human rights. They can be treated like we want to treat them, kill them, and they don't understand, and they don't have a proper health care. All of these old colonial sayings about the local population is part of a power system where you want to occupy, to take the land, and to kill the people. That's what we see. 2023, we did not believe that any civilized nation would kill 6,000 children and pretend it was self-defense. How low can you get? And we need to discuss it, we need to organize, we need to be active, because this is, at the end of the day, affecting all of us and our children and our grandchildren.
Yeah. And you said you also heard from a colleague of yours the very poignant one line, Gaza slowly dying.
Yeah.
What does that mean?
There is no water, there is no food, there is no shelter, there is almost no healthcare left. They operate in tents. The kids don't have water to drink. The patients are screaming in the hospitals from thirst. And what he says is his observation as a doctor. People are dying as we speak. Slowly, slowly. And the army, the Israeli occupation army, is inside Gaza. They continue the killing. They continue the attack on healthcare. Last night they bombed the Indonesian hospital. The day before they bombed the Al-Faqura school, the UN school, sheltering hundreds, if not thousands of people, civilians. So the world is sitting idle and watching. The leaders of the world, the good people of the world, are going to the streets and making all sorts of demonstrations. I was extremely moved when I came to Cape Town yesterday, and there were hundreds of healthcare workers with posters with the names of the killed colleagues in Gaza. Very moving, and that's what we need now. We need hearts, we need bold actions, we need unity between all walks of life, all religions, all political reflections, and we need to stand together and say, this is not what we want. Stop the bombing, open Gaza, get in support, and let's all go back to Gaza and rebuild Gaza to the beautiful place on earth it used to be.